This podcast was recorded at 12 p.m. on 29 June, Jakarta time. Things may have changed by the time you hear this. Enjoy the show.
Welcome back to Reformasi Dispatch. I'm Jeff Hutton.
And I'm Kevin O'Rourke.
Kevin, COVID is going from bad to worse. It feels like a red alert. I don't know how you're feeling.
Yeah, absolutely. Yeah, we're definitely in a serious crisis zone right now. Jakarta is probably the worst place in the world to be at the moment. So throughout this time, Indonesia has kind of fared fairly well, but now the pandemic has caught up and the epicenter of Indonesia's crisis is in Jakarta.
On the pod, COVID infections surged to a record, overwhelming hospitals and triggering more restrictions. And the presidential election silly season is closer than you think. The first round of the presidential election is moved up to February 2024. The window for enacting reform and shepherding big initiatives through Parliament is closing fast. And after the break, we talk with University of Indonesia epidemiologist Dr. Pandu Riono, who says thanks to more contagious variants, the spike in COVID infections will be much more dramatic than ever before. Before we get into that, what's the latest? We are breaking records and not in a good way.
Yep, because case detections have topped 20,000 for 3 days running and 4 of the last 5. And that has brought the 7-day moving average up to almost 19,000 a day. Nationwide. So that's week-on-week growth of about 55%. So if you want to look for a silver lining, I had to look long and hard for a silver lining here, but I guess that would be the fact that the rate of growth is no longer accelerating. So the 7-day moving average is still climbing, but the rate at which it's climbing has at least stabilized at around 50 to 60% week on week. That is a much higher rate of growth than what prevailed during Indonesia's previous spike that happened in January, February. So, there is some hope that maybe it'll plateau now and then eventually start heading down. But a lot of that is going to depend on the treatment of cases.
Is this all to do with the variant? You said that it's rising faster than it has in previous spikes. It's because we're now dealing with a type of virus that is more easily transmissible.
Yeah, I think so. Yeah, the experts have said that this is the Delta variant now circulating in Indonesia, specifically in Java. Java is accounting for about 80% of the cases nationwide right now. And East Java is not too bad, but every other province in Java is experiencing very severe conditions right now. So hospitals are completely full, overflowing. An order went out already late last week from the Jakarta Province Health Department head instructing all hospitals in the city to construct temporary shelters or erect tents somewhere on their grounds, in their parking lot, or the parking garage, or in their front yards. And so that's happening. But that only expands capacity so much. A lot of hospitals are converting their emergency wards over to COVID treatment facilities. And then there's a scramble to find places for isolation units for those diagnosis positive. There's a unused low-income apartment block that's been dedicated to isolation units, but it's not a very pleasant place to be. It's very just bare concrete and bare pipes on the inside, not much furniture. So it's definitely grim conditions right now. So no doubt about it.
There's media reports that the government is considering stricter restrictions. No more eat-in dining. It was limited to 25% anyway. It was supposed to be anyway. PCR tests as opposed to antigen tests if you want to fly on a plane, and a requirement to show that you're vaccinated, which is surprising. Where are you on vaccine passports?
Well, yeah, I think it's useful and important and necessary. Yeah, it's it's not ideal, but really no way around it at this stage. I mean, this is a severe global public health crisis, and so there needs to be measures like that taken in order to protect the greater good of the larger community. And it's an infringement on personal individual freedoms that people enjoy, but that's the reality of public health crises. It always has been. So Bali, for example, is requiring stricter requirements in order for tourists, both domestic and foreign, to enter into Bali now.
Oh, I guess the concern, though, for a lot of people is, yeah, I would love to get a vaccine and flash my vaccine passport, but there's no vaccines. It's a little bit frustrating. How is Indonesia doing on that access to the jabs?
Yeah, right. So I mean, yeah, that's sort of the underlying irony is that there's a lot of talk about how to handle vaccinations and who should be required and who is eligible to get them. And in fact, they're in short supply, so it's kind of a moot question. For example, the president wants to expand eligibility to teenagers now, which is great, but the vaccination rate is so slow right now because the supply is limited that it's really kind of a marginal issue at this stage. Dependency on the supply from China, and the government did elevate the rate up to around 1 million jabs per day. They hit 1.3 million on one day on 26 June, and they aim to be able to elevate the rate to 2.5 million a day by August. And there are shipments from Pfizer expected starting in August, lasting through the end of the year, totaling 50 million doses. So it will improve, but at the moment, vaccinations have still only reached, I think, about 6% of the nationwide target population in terms of full vaccination of 2 doses. There's a larger number of about 25 million people, or twice as many have received at least 1 dose. Yeah. So, but right now it's really triage and handling the influx of patients in hospitals, and only going to drive. And the overflow conditions in the healthcare system threaten to drive case levels higher because authorities are requiring or resorting to having some asymptomatic cases isolate by themselves at home. And in such a densely packed place as Indonesia, that doesn't work very well. And so it provides for family clusters and so on.
Have you been hearing anything about access to oxygen? That was a real problem in India when it was having its massive spike.
Yeah, there's a fair amount of attention to that. There was a few different statements from different directions regarding that. The company that produces it, the main producer in Indonesia, claims that the stock is adequate and sufficient. Government officials say the same thing. But a spokesperson for an association of private hospitals complained that supplies do seem to be a little bit tight, deliveries are a little bit slow, and the prices have gone up by about 10 or 20%. In Jakarta, the governor acknowledged that there were distribution problems. So it wasn't a matter of actual supplies, but really just the trucks and the delivery personnel to transport them around to hospitals because the demand, he said, was 2 to 3 times higher than normal. So the governor deployed fleets of vehicles from the provincial departments in order to handle that.
Indonesia makes its own vaccine, doesn't it? Or does it import them? They've got capacity to make them here.
Yeah, that's a benefit that Indonesia has relative to a lot of other countries. It's got a state-owned company, Bio Farma, that has a lot of capacity, but it doesn't have its own formula for a COVID vaccine, so it's merely using its capacity to fill and finish bulk supplies brought in from China, from Sinovac. There is a red and white Merah Putih vaccine in development, and that's supposed to be ready early next year. That'll be Indonesia's own homegrown vaccine if it proves effective.
The 50 million coming from Pfizer, was that part of the G7 promise, like the Biden G7 promise to send out a billion doses around the world? Is that some of the response to that?
No, according to Indonesian officials, this was their own negotiations directly with the company Pfizer.
Well, let's just hope that they have the capacity to move them around. They require special storage and super cold storage.
Yeah, so they'll just be probably available for urban residents, and it's going to be the kind of thing where they'll have to set up some ultra cold storage facilities, and then vaccine recipients are going to have to travel to that location to get the shots. I think it's going to be too difficult, I think, to transport those things around Indonesia, given the logistic standards in most places.
At the beginning of the year, we were hoping for if the Ministry of Health was anything to go by, 180 million people fully vaccinated by this time next year. That is looking, that time horizon is looking optimistic.
No, not necessarily. I don't think so. No, because the rate really can pick up quite a lot. I mean, the capacity in Indonesia is actually there to actually put jabs into arms. The personnel, the places, systems, and communications capabilities. That's all okay. It's literally just a matter of the actual vaccine material itself. And what happened in the U.S. was amazing because the country was just within the space of a few weeks virtually awash in vaccines. The healthcare personnel there literally could not give the things away. So that'll help, and that should happen elsewhere eventually. It's just a matter of time. So right now, the key, though, is really just the public health protocols, masking and social distancing and contact tracing. And that's really hit or miss. When in Jakarta and the main public places and the main roads, and more upscale venues, the masking is right near 100%. But as soon as you step out of those areas, it goes down pretty drastically. I saw a place in a remote part of Jakarta 2 days ago where there was a kolam mancing, a fishing pond, but it's one of those Jakarta-style fishing ponds, which is just a man-made square rectangle. It's cordoned off, and then people sit around it, and they rent fishing poles, and they go after a couple of hapless fish under this muddy water. So there's 50 guys sitting around doing this, and it was outdoors. Sort of there's a little makeshift roof over them, but it's basically open air. But still, it's 50 people sitting around, kind of cheek to jowl, pretty much, and there was not one single mask in the whole group. And this was 2 days ago, right when when the pandemic was, or this case spike had already reached such high proportions. So, what's interesting too is there's a video I saw of Ganjar Pranowo, the Central Java governor, whom we interviewed, and it's one of these TikTok videos basically that gets sent around. And the other day, basically, he had gone into one of the major markets in Semarang, the capital, and was just berating people for not wearing masks. And he had a supply there and was handing them out and really compelling anybody not wearing a mask to do so. It's unusual to see that. It's not the common kind of behavior of an Indonesian politician, or any politician for that matter. And usually they want to go out and forge some kind of friendly kind of ties with voters. But in this case, he was doing that in some cases and cajoling people in some cases. But then he was also really barking orders. So it was funny because he was on his bicycle with a biking helmet and a mask. And then he had a little microphone around his neck that was connected to a loudspeaker that his aides were carrying. And he had a couple of police with him, I think, and then somebody who was using this camera to make the TikTok video. So it was a whole kind of little entourage going around, but he had this loud loudspeaker and came up to this group of about 6 or 8 young guys, sitting around a table, drinking coffee or tea and smoking cigarettes, all face to face, really tight. And he came up to them and explained to them that you can't do this. It's not healthy. The hospitals are full. The doctors are tired. You need to move away. And they just sat there. And he said, this is not the time to do this. You can't be sitting like this. It's not proper. And they still sat there. And then he finally just said, move it now. And they did. Finally, they all kind of moved back.
Oh, well, we're going to look for that and maybe put it in the show notes. That sounds like something he would do. Of course, I'm trying to segue here, but Ganjar is one of the hopefuls in the presidential election, and his performance during this time of COVID will be very much front and center. He'll be assessed on it if he hopes to be a candidate in aforementioned presidential election, which is coming sooner than we thought, by several months.
Yeah, so there was a decision made by the government to move the 2024 national election date forward just by a few months. Normally it happens sort of in the middle or the end of the second quarter of the year in past election years. This time they're going to do it in the middle of the first quarter, so February 2024. And the reason for that is, because of the regional head election schedule that President Widodo changed around. So those were supposed to happen in part in 2022 and in part in 2023, but the president wanted to put all the elections for governors and district level heads on a syncopated schedule nationwide, so everybody will undergo election on one day everywhere, and that'll happen in November 2024. So because that would have been too close to the original national election schedule for the presidential election and legislative elections. Therefore, that national election got moved forward by a few months to create a bit of a space.
Well, what does that mean then for when the major parties have to have their nominees already?
Well, last time around, the Election Commission, the KPU, set a deadline for parties to submit their nominations of tickets that was about 9 months ahead of the election itself. So if we're talking about February 2024, that means that deadline is probably going to be mid-2023. And so the maneuvering for those tickets is going to be in full swing, certainly by next year. It's already clearly begun now, but it's going to be a lot of attention and chatter and speculation, and then ultimately, ironically, the major decisions might actually only happen the night before the deadline. That's what has happened in the past, including in 2018.
So this time next year is sort of when we'll see some sense of who the nominees might be. And between then and now, lots of posturing. What does that mean then for policy initiatives? Like the old adage in the US is that, a president really only gets to be president for 18 months. And then other than that, he or she, so far it's only been he, is either running for re-election or there are midterms and all this sort of stuff. The same is sort of true in Indonesia. If Jokowi wants to get major initiatives through the parliament, when would you say his time will be up?
Yeah, it's going to be a little bit interesting for sure, because there's a lot of dynamics at play here. One is the pandemic itself that's distracting everybody for now, and also sucking up fiscal resources and depressing state revenue. Another dynamic is that Widodo himself is not going to be running again, so he himself can do whatever he wants, but the parties are going to be posturing for the legislative election in a major way. And then, of course, Widodo has conferred about half the cabinet to party representatives, so if he wants to implement reforms that only require his cabinet, that's going to be tricky unless he reshuffles the cabinet and takes out those party reps. Because otherwise, the major election looming in 2024, which is an open race, which is wide open, and there's apparently at least 3 presidential candidates with substantial poll support and therefore good prospects. That's going to be a highly competitive race that's really going to distract the politicians and the political elites and the policymakers. So, one school of thought is that the pandemic is a positive thing because it's shaking things up so much that it's creating opportunities, whereas before there were vested interests that were able to veto any type of change or break with the status quo. We've seen that Widodo administration has been willing to push forward the omnibus law last year. Lately, it's been talking about a carbon tax, shifting away from coal in the power sector, taking out premium petrol is already diminished in filling stations around the country. So, there's been a few different kind of reforms like that are actually made possible by the pandemic, especially tax initiatives too that the finance minister is putting forward. But on the other hand, the outlook for reform is tricky because, one, Widodo has backpedaled a lot on governance reforms and institutional reforms and allowed the Anti-Corruption Commission, the KPK, to weaken so much. And also the factor of the election coming up, consuming a lot of energy and causing a lot of party leaders who also happen to be major policymakers to think carefully about their stances and positions on issues that have been very controversial in the past, as seen by the demonstrations back in 2019 against the omnibus bill at the time. One of the key figures is Erlangga Hartarto, so the chair of Golkar. He's the coordinating economics minister and sort of the chief overseer of economic reform initiatives thus far. And he's ostensibly a candidate for president, although more realistically he'll be trying to secure a slot as vice president. But whether he stays in the cabinet or whether the president needs to replace him in order to have somebody more neutral, this is one possibility.
Okay, let's leave it there. Coming up, Pandu Riono, and we'll talk to him about COVID. Pandu, thank you so much for joining us. This must be a very busy time for you. I want to ask you, just sort of stepping back, looking at the pandemic. It's been over a year now. I think we spoke first about a year ago. Just the course of the pandemic, is it working out about how you expected? Are we where you thought we might be? Are we worse off? I'm curious how you would sum up the past 12 to 15 months.
Okay, thank you, Jeff. Actually, this kind of pandemic, this very long, and we never reach the lowest cases, but always still in high cases that confirmed by tests, and also there's so many people go to hospital, and some of them is died. It means that we wish we can control this pandemic last year if the government implement that we suggest to do the exactly we miss. I mean that we predict by using mathematical modeling, and this mathematical modeling is based on the assumption that government will implement the strong policy for controlling this pandemic, but this never happened. It's never happened, and that's why until now we got a very bad or worse situations in the current maybe in the last month until now, and will be still in the next month, the increasing number of cases, and also increasing people go to hospital because they need taking care, and some people will die. The the peak will be higher compared to the last first wave in January and February, because the situation is now very very different.
The peak will be higher. Oh, then that begs the question: how high will this peak go?
We don't know. It depends on the government. Even until now, government is not implement the strong restriction for limiting the people activity, and they call it PPKM. Before they using the term PSBB. Actually, it's the same lockdown in Bahasa, but it's different managements. Before is last year is PSBB is under controlling by local government like governor and mayor, but now is controlling by central government. Is worse because the central government is under committee controlling for pandemic and restoring the economic. It means that they have two jobs the same time to controlling and the same time to restoring the economic. That's bad management because the head of this committee is the economic minister. They will never think about how to controlling the pandemic. They always think about how can Indonesia move up the economic situations.
And you've been fairly clear that if you want to help the economy, you have to control COVID.
That's true. That's true. And now I said that please controlling the pandemic because we want restoring the economic. Without controlling the pandemic, we never restoring the economic.
So, if I understand you, Pandu, then I think your view is that the government is being quite callous or uncaring about the public because there's a conflict of interest in the management with economic ministers too closely involved in the pandemic response. Is that right?
Yes, that's true. That's this conflict of interest between this because the minister is thinking more economic, not controlling the pandemic. They think the time or the vaccinations can controlling the pandemic, but it's not. It's very difficult.
But how about the president himself? Do you see this as being a characteristic of President Joko Widodo, who always voices concern about the livelihoods of the poor?
Yeah, I think he got the wrong message from the minister. If the minister of health totally devoted one to controlling pandemic, even before he was the vice minister for public company like BUMN. And it means that Pak Budi Gunadi is now devoting to controlling the pandemic because also he wants people not suffer a lot because of the situations.
Right.
So, if you met with the president in preparation for this next spike, I'm assuming you haven't. What would you recommend?
If I met with him, I said to him that Mr. Jokowi, the nation need your leadership, because please lead us controlling the pandemic. Don't delegate to your minister. Just do it now using your leadership with your minister and revitalize the government's functions. The function of government should be focused more on the pandemic, because it will be more than 1 year and maybe more than 2 year you are still in the pandemic trap because you are not directly lead this nation to control the pandemic.
Do you anticipate a change in policy in the near future and maybe a move from the PPKM micro at the local level to a larger scale restrictions at maybe the district or provincial level?
Yeah, in this during last week, I pushed a lot. Even I met with Minister of Health. Please speak with the governor of Jakarta. Please tell Jokowi to make more restrictions. The only way to stop the transmission is stop the activity of people at least 2 weeks. Or if he doesn't want, just try 1 week, and then we can evaluate the impact of this restriction. It means the Indonesian lockdown, and hopefully tomorrow the president, because the president is always declare something. The important thing is on Wednesday. The Wednesday speech is very important for him to declare or make statement that related with the national policy.
Okay. So we'll see what happens tomorrow. Listeners will probably know by the time this podcast
Yeah,
drops.
hopefully.
Yeah.
Cross my finger.
Pandu, I wanted to ask your opinion about the Coronavac vaccine because healthcare workers are all fully vaccinated with Coronavac, and there are reports from many districts that hundreds have tested positive. However, not so many are seriously ill or dying yet, seemingly. So, what do you think about that? What can we know about the efficacy of Coronavac vis-a-vis the Delta variant or whatever variant is circulating now?
Yeah, I think it's everybody talk about the corona vaccine doesn't work. It works, but it's not the best from the available vaccine in the world. Sinovac Coronavac vaccine is the lowest, maybe around 50 until 60%. It means that it's not great for efficacy, but it still work. It still work because when all the health worker in the current situation, there's a lot of health worker infected, but we observe the death of health worker is not like before, and we look at the data, maybe 61 death of the health workers. Actually, the 51 is unvaccinated, not fully vaccinated, and the 10 is vaccinated. It means the odds for death and for the health worker is 5 times if they are not yet fully vaccinated. It means it works.
Yeah. Okay. That's interesting. Do you agree that this is the Delta variant that's circulating now? Is the evidence clear about that?
Oh yes, of course. We already suspect since in the first month of this year because we find the Delta variants already detected in some area in Indonesia, and then become very clear after some Indonesians migrant workers back to Indonesia. Some of them already bring the virus, and then we check it is already Delta and Alpha variants, and then at the time Alpha variants. But when we see the a lot of health worker in not health worker, maybe in the city in Central Java, Kudus, and in Madura Islands, in Bangkalan. Many of them, at least in Kudus, is 60% of the sample that examined for genome sequencing is Delta variants. And then in Jakarta, we got a lot of all the variants already in Jakarta, but the proportions of the sample is dominated by the Delta variant. I believe that currently Indonesia is already dominated by Delta variant. That's why the step up is like climbing the cliff, not climbing the mountains. It's 90% of cases increasing is very fast and very fantastic. It means that this is like Indian increasing cases in the second wave. This is like when we discuss when India got the second wave, everybody asked me, "Do we follow the India?" Maybe because we are the same people like India. What do you mean? It means that Indonesia and India is very not not disciplined. They want to do what they want. Yeah, it means that I call it is the herd stupidity. The herd stupidity become very popular when I observe the many people go to mudik during Lebaran, and even the government not trying the best they could to stop the mudik.
Hmm.
Herd stupidity.
Hmm.
Yes, herd stupidity.
Yeah,
Yeah.
yeah.
We want to get the herd immunity, but finally we just got herd stupidity.
Well, just staying with so the conversation of vaccines and the Delta variant is the Sinovac and the Coronavac, are these effective against the Delta variant, or is that the right way to think about it? Should we be thinking about the efficacy of the vaccine in terms of its ability to keep you out of hospital?
Yeah, I think is I propose actually even the Sinovac company come to Indonesia, they propose the third injection, the third jab is Sinovac. And then I make comment in some meeting that yes, we need the third vaccination, but please not Sinovac again. We need the best one. I mean the Moderna or Pfizer, and we need more because the Delta variant is not the last variant that we can facing in the near future. Will be this type of virus is the mutated virus. They always mutation if they could. Even this is RNA virus, like HIV. It means that it's very difficult to achieve herd immunity when you facing the pandemic. The cause is by the virus that very easy mutated. Maybe in the in the future, maybe we will got the variant that escape for all the vaccination we have. It means the Pfizer, even the Pfizer and Moderna, they will make another template for version 2 vaccine because they got the new variants. It means that this is like long war. It means that this is like marathon, double marathon maybe. This is not a short-term war. It may be because we are too optimistic to become a winner, but actually, the virus still potential become winner in this year or the next year.
Hmm. Well, as for this week, hospitals are literally overflowing. So, what are the
Yes.
implications of that for the spike right now? Is there going to be a spike on top of a spike because of positive cases isolating at home?
No, yeah, maybe they will. I ask the expo place like in Kemayoran, Jakarta Expo Center place. This is very large expo center and near Wisma Athlete and the emergency hospital. It means that open up this place to become emergency hospital, and they will consider it as the one of the solution because it's very large and we can accommodate. But the problem is not only the place, but we need uh, doctor, we need nurse, we need oxygen, we need all the medical equipment, and also we need help.
Yeah. Is the oxygen supply going to eventually run out? Is it simply going to outstretch the manufacturing capacity at some stage?
Yeah, I think the because our Minister of Health is before working for the private company, and he got a lot of friends who own the oxygen manufacturer for industry, and then he is helping this college, or they just invite all the oxygen manufacturing that currently and before the pandemic only 20% of them allocated for health care, but now please all or maybe more 50% of the capacity allocated for the healthcare. It means that they should adjust for the pressure, the tank, and whatever they have, it should be adjust to the healthcare because before it just for industry. It means that we trying best we have to facing this kind of worse situation. We don't want like India is many people cannot be taking care in the hospital.
But as evidenced by your last comments, you have been unsparing in your criticism of the administration, and much to the delight of people in my profession. But I think that's come at some cost to yourself, right? What sort of blowback have you been receiving? I understand you've been trolled quite extensively on Twitter. What has your criticism got you?
A lot, but I don't care. I don't read the criticism to me. I just say what I want.
I thought you were also hacked, right?
Yes, before last year. Last year I got a hack, and currently I prepare myself to make some protection in my gadget, in my computer, and using NPM and many things that we got consultation from the our college in safety net. And please protect yourself because you are very vulnerable.
Yeah, but Pandu, I was also hacked, so I think all the finest people get hacked.
Even our student in University of Indonesia after criticize the president, they criticize the Jokowi with the king of what call is
Lip service. Lip service.
I forgot.
Lip service.
Yeah, the services, and then everybody got hacked.
Yeah, yeah. It's really unnecessary. Well, can I want to go back and ask one more question about you mentioned the spike in India, and of course Malaysia has been experiencing uh, very bad outbreaks. What can Indonesia learn from how India and Malaysia have grappled with their spikes?
Uh, I don't know if even the government not learn by their own mistake.
Hmm.
Last year we already knew that every long holiday or let people have some, I don't know, mudik lebaran is always followed by increasing the cases. But when I said that place currently is very different. If you cannot stop the massive mobilization during mudik lebaran, it will be very worse situation because currently potentially we have different situation because we have the new variants. This is very different, and because they don't think this is important, they just learn from the last year is not increasing much, they can still controlling, and then now it's become very worse. The just I just give a solution, please stop the people move maybe 1 week or 2 weeks, because that's the only way to stop the transmission. If you still let the people move out, the transmission still going on. Then we don't know how far the transmission. Even the in the hospital itself, they come to hospital is being negative, and then when because another disease, not COVID, and then when they're taking care in 2 days, and then suddenly they got COVID in the hospital in Jakarta, and many doctor is now, and many nurse, and even in some health center, half of them, more than half of them, got infected. This is very worse.
Great. Thank you very much, Pandu.
Okay,
Thank you.
thank you very much, Jeff and
Stay
Kevin.
safe, yeah.
Keep safe. Keep safe. Okay. You are in the middle of battle.
Yeah, that's right.
Jeff, are you already vaccinated?
I have had Kasatu. My the second one is in August. It's
Okay.
AstraZeneca. It's okay.
Okay. But please, AstraZeneca, it should be two. I mean, you should get the second. Don't forget about the
Oh, I
second,
will
Jeps.
not. I can't wait. I want them all. I want all the vaccines.
It should be, you like me, you like me. I want all the vaccination, the type of vaccinations, the type, not the brand. Please inject me.
It's like a status symbol. Oh, I've got the Moderna. Oh well, I got
Yeah.
Pfizer. Ooh, wonderful comrades.
Okay. Okay. Thank you. Thank you.
And that's the program. Thanks to Dr. Pandu Riono of the University of Indonesia. Our producer is Stephen Handoko, with editing by Aditya Akbar. Music by the Blue Dot Sessions. For a free trial of Kevin's Reformasi newsletter to read during the lockdown, go to reformasi.info. And if you're listening to us through a podcast app, please subscribe and rate us. It helps. As always, you can reach us at hello@onthelevel.id. This podcast is a production of On the Level Media. I'm Jeff Hutton. Bye for now.